Can you hear me? Okay, good, because I have a very soft voice and I don't like to shout, so I'm glad you can hear me with this microphone okay. Well, welcome everyone. Thanks for being here today. I really appreciate that Northampton County Mental Health and the Harvest Full of Hope allowed me this opportunity to speak to you all today. I really feel honored to be here. And I did stack the audience with a lot of my friends. So I love seeing, yeah, all my friends, all of you. No kidding. Um, so I want to get started here. I hope you all filled out your cards. I did write some instructions up here, but I think that Kristen, put your hand up, Kristen, and Amber. Where's Amber? Amber. They did a good job. Now, if anybody still wants to do this, if you want to participate and win a Lodge gift card, please get Amber or Kristen to give you an index card and write your full name on it so we know who you are and who we can give the Cafe the Lodge gift card to. And then write on the card why you're still in this field or why you're still in treatment, like who inspired you or what inspired you. And if it's a person that inspired you, please just use their first name. Because, we are going to be having, we're going to make a collage out of these inspirational quotes, and it's going to be on display at Cafe the Lodge. So when you go to Cafe the Lodge to have your wonderful meal, you can check out the inspirational quotes that everyone wrote. Now, at the end, we're going to draw, there are 10 gift cards for $10 each. And we're going to draw them at the end. We're going to read your inspirational quote. And we are also going to, what am I going to do? I wanted to let you know that I purchased these Cafe the Lodge gift cards with my own money, my Northampton County pension money. And the reason why I'm doing this is not only just to promote Cafe the Lodge, but because I figured I'm going to be boring. Like, how can I keep these people here to the end? So that's my plot and my plan to keep you here. So anyway, I always do a commercial for Cafe the Lodge whenever I speak because I love this place. And I am the self-proclaimed #1 fan of Cafe the Lodge. This program was developed during the closure of Allentown State Hospital. And if you've never been there, I highly encourage you to go. The food is wonderful. And it's not just about the cafe. They have an employment component to it. They have a residential piece to it. This program represents recovery in every sense of the word. They are fully integrated into the community. Anybody can go there. They have activities that anyone can participate in. It doesn't matter what county you're from or if you have a disability or not. They have activities that you can actually participate in. And those things don't matter. I got too close to that thing, didn't I? So there's my spiel about Cafe the Lodge. Oh, and for the winners, please take someone new to Cafe the Lodge that's never been there. We need to support programs that support recovery. And providers, have your staff meetings there. There's a room in the back that you can reserve for free. Or get it delivered to your office. They also cater. All right, now I'm done. So now I'm going to introduce myself. A lot of you know me, but not everybody knows me here. My name is Wendy Heatley, and I currently work for the Office of Mental Health and Substance Abuse Services. But when I first started out, and you can see the outdated MHMR on there, that's like way back. I started out working for Northampton County in children and youth for 2 years, and I went to mental health because that's where I needed to be, that's where I wanted to be. Once I got into mental health, I was the housing specialist for a while. If anybody knows Moravian 4, I was the housing specialist that kind of initiated that whole thing. So that was a pretty cool thing. And then I became the CHIP coordinator for a while, tracking the folks coming out of the state hospital and the programs, monitoring the programs that they went into. And then I was the deputy mental health administrator. I took over after Marjorie Martin, who's here, one of my mentors. Yeah, Marjorie. And Kathy Cromer's here. She's doing it now. I'm sorry. But anyway, I was there for 20 years and then I left. And I wasn't sure I was going to come back. I thought maybe I would go into a completely different field. It's not that I didn't love what I did and the people. I loved the providers. I loved the individuals in mental health recovery, the family members, program development, loved it all. Did not like the fact I felt very demoralized about the pay. Very demoralized about the pay. And there were other reasons too, but I'll just leave it at that. Obviously, you guys know I came back. I'm here. I've been with OMSAS now almost 10 years as a licensing representative, and I'm also a certified peer specialist. Yeah. Hey, all the peers in the room, let's hear it. Yes. And, I'm going to embarrass my husband now. So when I first started talking to him about becoming a certified peer specialist, he wasn't so sure about that. He didn't think that was necessarily a good idea because of the stigma. He's heard me talk, and he knows there's still a lot of stigma in the mental health field, let alone out there in the big world, And so he was worried it would hurt my career. And I said, well, this is the very reason why I'm doing this, is to help eliminate stigma. I'm like, if I do this as a mental health professional and I become a peer, maybe other people will too. And I know that there are other mental health professionals out there that became peers, Trish Nye from Penn Foundation. And I'm hoping more people can do it. And I know it's tough because, it's 2 weeks, but now, they have the hybrid thing now where it's virtual. It might be a little easier. But I really am hoping to inspire some people to become certified peer specialists or even certified recovery specialists. So anyway, long-winded introduction, but I want to get back to my hubby because I really didn't embarrass him yet. So we were supposed to have, normally when you graduate from peer support, the graduation is a big deal. It's a big deal. And we didn't have one because it was during the pandemic. And it bummed me out because, I wanted to invite, I had people in mind I wanted to invite. And, anyway, the day of that would have been the graduation, I get these flowers at my house. And I'm like, not many people really knew I was doing this. I'm like, where'd these flowers come from? They are from my husband, who's at home with me and had them delivered to the house, which is amazing. But what he wrote in that was way more important. What he wrote in there was, congratulations, sweetie, the world needs more people like you. And that blew my mind. I was like, oh my God, this is the man, the person that knows me the most, and this is what he says. But I want to tell you that this room is filled with people like me. You're going to have to buy a lot more flowers, honey. So there, I'm done embarrassing you. You can relax now. So, I'm hoping to inspire you today. I'm hoping you're not bored, and I hope you walk out of here feeling energized to do a lot of things, maybe get involved in advocacy, at least go out and vote. That's coming up pretty soon here. I do want to definitely normalize the conversation around mental illness and suicide specifically. I want to inspire you to lift other people up, and that's what I'm going to do today. I'm going to lift some other people up that have lifted me up. And, you know, if you're thinking about leaving, I hope you won't. I really hope you won't. I hope you can stick it out because things are going to get better. So why I'm still here working in this field? Why did I come back after that year that I wasn't so sure that I was going to come back? Well, you all know the answer. My big joke. Yeah. Not the money. I came here for all of you. I came back. I missed everyone. I missed the whole field, the community. I missed the providers. Like I said before, I missed working with people in recovery. And I missed the family members. I missed everything. And I had to come back. And fortunately, Marcy Ratchko's here. Somewhere Marcy's here. I got to come back to OMSAS and work for Marcy. And I'm so happy. I love my job. I absolutely love my job. I'm so glad I came back. Anybody recognize this mug here? Where is it from? Cafe Lodge. Of course. Whenever I see this mug, I have it at work, seeing greatness in self and others. Reminds me of Ike Van Munster every time I look at it. Now this morning, John Mooney won the Ike Van Munster Award. Let's hear it. Come on, let's hear it for John Mooney. Well deserved. I know that man shoveled snow to get out to group homes when most people would have just not done that, but shoveled his car out, and he would do whatever it took to get to work and to help others. And Ike, wow, what a great man. I think you all know Ike from coming to this conference, but Ike is the founder of Cafe the Lodge. So it all started there with him. And then Jackie Tightsworth came in, and Ian Panico, who's right here. And over the years, you know, it's just been taken to another level. It is just such an amazing place. And how many awards have you won, Ian, at Cafe the Lodge? All of them, right. Oh, there's Alyssa. I didn't see you sneak in here. 5 or 6. And there's going to be more. They'll win more because they're amazing. They're so involved in the community. They got that big old mural on the side by being involved in the community. So why am I still living? Because I was never always sure I wanted to be on this planet. And even though I'm doing really well, I still have suicidal thoughts. They're still not going away, and they're never going to go away for me. That's what I've decided. They're just not going to go away. But I kick their butts whenever they come in. I'm like, get the heck out of here. You know, I need to stay busy, and I need to sometimes reach out to some of my supports. There's a few people that I'll go to. And the thing is, I feel like if we talk about it, and I feel like just me talking about it now here today with you, it takes some of the power away from those thoughts. It takes the power away, like if you can talk to somebody else about it. And there's been so much stigma about it that, you know, people don't talk about it, and they're alone with their thoughts. And that's the worst thing. That is the worst thing, to be alone with those thoughts and feel like you can't talk about it. Just wanted to put this up here while I'm talking about suicide. I'm sure most of you know about 988, but it's kind of like 911, but it's for mental health. So if you call, text, or chat you're going to get a caring person on the other end there that's going to help you and get you connected to the help that you need. And I put it in Spanish there for my Latinx brothers and sisters, just to make it a little easier. I want to, I couldn't figure out how to make that part Spanish up there, but I did my best. It's okay. It's all right. We are a small friendly group, right? So these are all the things that kept me here. And the main thing is I never gave up hope. I always had just like this little grain of hope that things were going to get better. And of course, you can see all these other things that helped me. Of course, my husband, amazing man. And friends, you guys, like just these are what I call my anchors that keep me here. And actually, sometimes I feel, and this sounds bad, but I resent all this because the pain is so bad sometimes that I wish I didn't have that so I could just go, But I have all this, and I love all this, so I'm going to stay, right? So it's really important to find your anchors. Oops. Yeah, we can't pass the fur babies. I mean, you can't, animal lovers know, right? Who rescued who. So the little cat down here with the mouse, that's Tuck Tuck. And that's Anna Roo in the middle. And this is Jer Bear. He looks cranky. He is cranky. He is cranky, but he's very loving. So pets are huge. And I love programs that try to figure out how people can have their animals come with them or take care of their animals if they have to go into the hospital or crisis res. Like, I love that stuff because they're important. So everyone that knows me knows I love Marshalls, and I do not own stock in Marshalls. But last month, I was coming back from my parents' house, and I always like to stop at this Marshalls because it's halfway on the Buckhorn exit. And I go in, get my stuff. The cashier's ringing me up, and she goes, "Would you like to donate to blah, blah, blah?" And I said, "No." I said, "But if it was mental health, I would." And she stood back, and she goes, "That's right." Because this was last month. She goes, "It's Suicide Awareness Month." And I said, "How did you know that?" And she goes, "Well, I go to Danville High School, and I'm part of the Suicide Prevention Club." And I was like, "Thank you." Another reason. You know what I mean? Another inspiration. Young people. They get it. They talk about it. So now I want to introduce you to Kristen Bertucci. I got to go up here to do this. Kristen's one of my inspirations. She keeps me going. She is a certified peer specialist, CPS supervisor, RAP facilitator, Hearing Voices network facilitator, and is currently the peer representative for Northampton County Crisis Intervention Team program for police, corrections officers, and first responders. Kristen has also been an active member of Northampton County Community Support Program. Over the last year, she has stepped into the role of peer leader by tirelessly advocating for adults living with mental illness in the Commonwealth. Kristen's strategy has been to monitor news outlets for stories and obituaries of Pennsylvanians who have died by suicide. She then forwards the news item to the local representative of the individual who died by suicide, and she makes them aware of the death. And she writes in the letter, and asking the representative to help prevent suicide by supporting increases in mental health funding and to back any legislation which would improve the quality and accessibility of mental health services in Pennsylvania. Kristen participated in the 2023 and 2024 walks on Harrisburg. In 2023, she wore a straitjacket she made from material that looked like the American flag. Her visual advocacy illustrated that in America, the land of the free, individuals with mental illness are not often free due to an inadequate and medically based mental health system. She was also able to meet with several legislators at the event to advocate. She's been educating herself. She goes to trainings. She does research. She listens in on events like the governor's budget so she can be aware of what's going on. She's also aware of the stress that advocacy takes and is mindful to maintain her mental wellness. To that end, she developed a support group for herself consisting of myself, members of NAMI, Northampton County Mental Health, and her supervisor at Recovery Partnership, Scott Kiefer, who's here. My peanut gallery. So anyway, she would send out the letters to us that she was going to send out and ask us for feedback, and she was always open to it. She would also reach out to us for support when her mental health was being impacted negatively by the advocacy, because it can be a downer sometimes. She's now getting involved in the CSP again, and hopefully she's going to get the CSP to help her with this letter writing campaign. She is determined to affect positive change, and for those of us living with mental illness, she's an advocacy force. Let's hear it for Kristen.
Hi, guys. Thanks for coming. Hi, Stephen. I'm really excited you guys are here. I was also very excited when Wendy asked me to speak. She told me what the topic was, and my response was, "Ooh, that's heavy. I'm in." So not too long ago, I was speaking with someone who was experiencing a mental health crisis. And they were also experiencing feelings of suicidality, and those feelings had really isolated them from their family and friends. And they told me a story that really stuck with me. They had gone out to get coffee with one of their friends and had tried to talk about how they were feeling. And the response they were met with was that suicide is not a coffee conversation. Not a coffee conversation. Over the last year, I started monitoring news stories across the state of Pennsylvania about individuals who had died by suicide. Throughout these advocacy efforts, it became evident that it's much harder to change a system as one person and we're one voice. The system will it'll outlast one person and one voice. And what I realized was if I was going to be sustainably successful, I needed to find something that would counterbalance the insurmountable hopelessness that I realized was going to come along with this work. I can send out a ton of emails. I'll get less responses back, and then the supportive responses are even fewer than that. So I noticed it started taking a toll on me, and that's when I reached out to some individuals that had more experience in state advocacy and working with legislation. And that group of individuals, like Wendy, really supported me to lean into the discomfort that I was going to continue experiencing on my advocacy journey. And then I came across a story about Mark Chambers. Mark Chambers was an individual who was experiencing a mental health crisis and having feelings of harming himself in Bucks County. His mom called police for help. That call ended up resulting in her son being shot 16 times by police. So, unfortunately, the only eyewitness report that I found had said 16 shots, and the only other piece of media that I saw that really had anything to do with who Mark was as a human being was his obituary that stated, in lieu of flowers, donations in Mark's name can be made to the Society of American Magicians and NAMI. And that was really that snapshot of who that individual was. So naturally, I turned my attention to CIT, which is the Crisis Intervention Team. My goal in doing that was to try and prevent something like this happening in our counties to some of our friends that I work with, or myself. And just for anybody who isn't aware, the Crisis Intervention Team works to train first responders and law enforcement officers on how to deal with individuals that are experiencing a mental health crisis. So I went in with my goal to try and effect change to prevent this from happening in our counties. And what I didn't anticipate that I would learn was just how isolated law enforcement officers and correctional officers are too. There's that stigma. It exists everywhere for mental health. And in a profession where you're seeking treatment could negatively impact your job, who can really blame someone for not seeking that help? Even when it seems so accessible through their plans. Over the course of my work with CIT, I've seen a significant increase in law enforcement officers and correctional officers that self-disclose about their own mental illness or that of a child or a family member. So if there's nothing else that you take from me speaking today, please consider this. Why can't this be a coffee conversation? The only way that we're ever going to get past this insurmountable barrier to have these discussions is to have them and to normalize them. Thank you.
Great job, Kristen. She did, yes. Kristen was a past winner of the Ike Van Munster Award. Thanks for reminding me. And I think there are some other people in the audience, too. The next person that I want to introduce you to who has inspired me and continues to inspire me is Amber Karam. Now, I first met Amber on our Crisis Intervention Team Committee for Northampton County. She was our forensic certified peer specialist, and what that means is she shared her story, of her lived mental health experience and her experiences with first responders. That takes guts, and to talk in front of a bunch of police officers. Very scary, right? Yeah. That's what she did for us. But she didn't stop there. After that, Amber, she became a certified peer specialist supervisor. And then she got her master's degree. Then she got licensed. She's now a licensed clinical social worker. And somewhere in between there, she decided to start her own nonprofit, Aspire to Autonomy. She helps people who are survivors of human trafficking through her nonprofit. Do you think she stopped there? No. She partnered with Concern and now has an outpatient clinic specifically for individuals who are survivors. Amazing. Kristen and Amber both, just absolutely amazing. Come on up here.
Hello. So I'm going to share a little bit about my story and my journey in the human service field, as well as point out some of my helpers along the way. 12 years ago, I was brand new in my recovery. I felt defeated in so many ways. I had experience in working in human service field, but because of my consequences I was facing due to things that happened in my recovery, I was not sure how to move forward. I did the only thing that I knew how to. I tried to take a step forward. I got into therapy and ICM services as well as got a job. I wasn't able to get a job in the human service field, but I was able to get a job at the Dollar Tree. It was at this time I found my first helper, my ICM, April. Soon after, my ICM suggested I apply for a county-funded peer support training course. I had never even heard of peer support, but once she explained it, I felt a sense of hope in getting back into the helping profession. I applied and was accepted, and my journey back into the field began. Peer support not only provided me with the opportunity to get back into the field, but it led me to organizations with people who were willing to meet me where I was and not judge me for where I had been. And this inspired me. A couple years later, I was promoted to supervisor of a peer support program. This is where I met my second helper, Wes. Wes was my supervisor and truly embraced me in my role and valued what I brought to the table. Soon after, I began school for my MSW. As a supervisor, I was able to see the impact of peer support, not only for clients, but for peers that I was able to hire and oversee in their roles. I also got experience being part of a larger system as I began attending community meetings such as a provider meeting. This is where I met my third helper, Wendy. Being the autistic woman that I am and being shy, anxious, struggling with small talk, it was really easy for me to attend meetings to get help and resources for my clients, but it was not easy for me to share and engage in small talk afterwards with individuals. But somehow I was able to connect with Wendy, and she has supported me in so many ways along the way. While attending school, I had to complete 2 years of internship. This provided me with an opportunity to explore the field differently. I began working with survivors of human trafficking. This is where I met my fourth helper, the executive director of the nonprofit I was placed at, Christy. Christy believed in me and empowered me. She gave me the concept for a program to create and tasked me with putting it all together. This is where I began to understand the openness of social work and the ability to help people outside of micro-level work. By the time I graduated, I felt inspired to create a nonprofit to help meet the needs of the community that I identified while working in my internship. The one great thing about being a social worker is the ability to change things up and find your place. You are never stuck, and as you grow as a person, you can grow professionally. I created Aspire to support survivors of human trafficking and to help prevent trafficking. However, I also wanted to pursue my goal of becoming a licensed social worker. The thing is, I had a record and was told while I was at school that my record may get in the way. But the board approved my application, and I felt empowered by the support team that I built along the way. I left peer support and began working as a therapist while growing Aspire. I had a new goal of becoming a licensed clinical social worker and opening a small private practice. 2 years later, I got my clinical license, and this is when I met my fifth helper, Shannon. Shannon was my supervisor at an outpatient mental health therapy program. And after hearing about Aspire and my desire to open a mental health clinic, but had hit a wall with some barriers, she wanted to help me push forward by advocating for my partnership with a company that was working for a larger nonprofit. Through the partnership that was born, Aspire was able to open a mental health clinic that specializes in supporting those who have been trafficked, while still providing mental health support to anyone seeking services. While working towards implementation of the mental health clinic, I took the steps to start my private practice. I love being a social worker. I love being in a profession. I think I hit the thing. Sorry. I love being a social worker. I love being in a profession that accepts me, empowers me, and it allows me to grow. In all my years in the helping profession, I've been able to do so many different things. I was a peer support worker, a supervisor, a director, an advocate, a trainer, a therapist, a grant writer, and a nonprofit leader, as well as an owner. It has allowed me to wear so many hats, be challenged, and use my own story to create change and help people. I am still in the field because of the ongoing opportunities to grow and fight stagnation, while helping those we support to overcome adversity and meet their dreams and aspirations. Just as I had many supporters on my journey, I strive to be a helper for those looking to find their place in this rewarding profession. Thank you.
Thank you, Amber. All right, so we're on the next slide already. More inspiration. So this is Kat and Keegan. And Keegan is a certified peer specialist, and Kat is a certified peer specialist supervisor. And they were working for an organization in Bradford County in those roles. And they decided, you know what? We want to start our own peer support agency. And that is exactly what they did. And completely peer run. Nobody else. All peers. And I want to bring them up here because they have an announcement to make. Come on up, Kat and Keegan. Oh, and they're doing it in Sullivan County, which is a very underserved rural county. So that's fabulous.
So yeah, thank you. Uh, a year ago in September, out of frustration, I guess, we made a phone call to OMSAUCE, and after months of talking about it and not really sure on how to do it or what to do, we made that phone call and previously talking about it with other people, a lot of ridicule and laughing and pipe dream, there they go, pipe dream, you know, they're not anything to worry about. This will never happen. So we called and talked to Wendy, and she said, yes, I like it. Come see me. So that was actually, you had this 2 days early. So on the 17th of October, a year ago, we met, and it was a very positive, uplifting experience, and we walked out of her office knowing that we could do this, we were going to be successful, it was going to be easy, we were going to make loads of money. That was the pipe dream.
That was our dream.
We went to eat lunch and talked about it, and that day, while we were still inspired by Wendy, we formed an LLC in the parking lot of that restaurant. So this week, in 2 days, the 17th, will be our 1-year anniversary of forming the business. I think February is when we were officially inspected by OMSAUCE. So this Friday, we are having our open house and celebrating 1 year. And we have already are in motion of adding to our services. But that'll be in the news later. We can't disclose. Oh yeah, so we have 6 employees. I think we have 17 individuals that receive services from us. That's not a very big number, but if you've ever been to Sullivan County, that's between nowhere and no place. So we feel we're doing really good, and it's growing. Referrals come in seemingly to us every day. So, yeah. The reason we do this is because of people like Wendy and people like all of you. We've all needed that help at one time or another, and there's no better reward than receiving a smile at the end of the day from somebody. So that's why I still do it.
I'm good. Thank you. So, their ribbon cutting ceremony, is it at 2 o'clock on Friday? 2 o'clock, Mildred, Pennsylvania. Go up there and support Phoenix Peer Support Services. So we're running low on time, but here's one of my other inspirations. Obviously, because he has been very public about his mental illness, he got treatment, and he's still a United States Senator for our state. I really would love for you to all get involved, and there's a bunch of different ways you can do it, but what I'm suggesting is go to your community support program meeting, for starters. Every county has one or joined her. We're probably going to run short on, or over time, I'm sorry. Community support program, it's a group of people like us that gets together and talks about how we can end stigma. And we don't just talk about it, we do things like suicide prevention campaigns. We put up billboards. We do a lot of education. So we have a lot of trainings. I have a QR code up here for the Pennsylvania Mental Health Consumers Association that you can come up and scan, and you can get information on where your local CSP is and how to get involved. And I know that Kristen passed out some slips of paper to you with Lehigh and Northampton counties information on it. I'd also like you to get involved in Mental Health Planning Council. I always call that kind of like the state planning for mental health. And I have a QR code up here for that. These are just more opportunities for you to have your voice heard. Local level, state level, get involved, and you're gonna meet some friends. I met Kristen through CSP. I met a lot of my friends through CSP. So get involved and make yourself some more anchors. So it's frustrating. You know, you go to these meetings, people say the same stuff, you feel like you're not being heard. Well, I feel that way sometimes too. And I have to go back to the beginning of my career in 1993 when we hardly had anything. We had state hospital, inpatient, outpatient, partial, some case management, some group homes, crisis. That was about it. That was what we had. You know what we have today. We have a lot more than that, right? What do we have? Peer support. Peer support alone, and all different types of peer support. We have Reflections, the 24-hour peer support program. Yeah, Reflections. You can go there instead of going to the hospital or instead of going to crisis residential, which is another good option. We have ACT teams. We have, what do we have? Help me out here. We have Robbins Bower, crisis residential. We have tons of program. We have made so much progress. We have been heard. It's just not enough, and it doesn't come quick enough. That's why we need you all to get involved in the advocacy. I also want you to get involved by talking to your local legislators. And I know that can be intimidating. So educate yourself. NAMI Smarts, they have a program, a training program that is free, and they will help you figure out how to talk to your local legislator. They will help you put your story together so it can be most meaningful and most impactful, because sometimes you only have a few minutes to talk to them. The NAMI table's here. Maggie Murphy's here. She would be over here, but she had to be over on the other side because she's on the panel. Maggie Murphy is the trainer, and she's so thrilled I'm talking about it today. She wants you to go to the NAMI table. She wants you to ask her to come and speak to your group. So please get educated on how to advocate most effectively. And vote. Vote. I don't care how you vote. Just vote. Get involved in the democratic process and have your voice heard.